And welcome to the Dr. Bob Show. Have you ever been bothered with dry eyes? They have that sort of gritty feeling. You go to the drugstore and you get some eye drops, some tear replacement. Why are you getting those tear replacements? Do you have dry eye syndrome? Do your eyes sting? Do they sort of burn? Do you sort of get where you have to blink several times? Well, a lot of people have dry eye syndrome. And the problem is, can it lead to something bad? Is there some problems underneath that we need to learn about? Well, that's what we're going to be talking about on this show. My guest is Dr. Darin Smith, board certified ophthalmologist, MD eye doctor. He'll be answering our questions on how to prevent dry eye syndrome, how to treat dry eye syndrome, what is dry eye syndrome. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about sinus infections and cough. Is there a relationship with blocked sinuses and a cough? Could there be some hidden asthma? We'll try and talk both about sinus infections and asthma later on in the show. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Darin Smith, board certified ophthalmologist, MD eye doctor, and we're talking about dry eye syndrome. Darin, are dry eyes common?
They are very common. One of the most common things I see.
One of the most common things you see. So tell me, how are the eyes normally lubricated? What do the tears do? What's the anatomy of tears?
So it's amazing that the tear system is really quite amazing. In fact, when I was younger, I thought, dryness, kind of silly, put some drops in there, no big deal. But really, it's a very complicated system. So there's actually 3 components to our tears.
3 components.
So everyone thinks of just the liquid component, but there's actually also oil and there's mucus.
All in tears.
All in our tear film. And all 3 of those components need to be in there in the right ratios and healthy in order for the cornea and the rest of the eye to be well lubricated.
So tell me, where is the lacrimal gland?
So the lacrimal gland.
What is that?
So the lacrimal gland is what makes the liquid part of the tears. And that sits up underneath the bony rim up here on the outside corner.
Yeah, so it's right there. So it drops tears in, and then they wash the eyes.
Yeah. So the oil comes from little oil glands along the eyelid margin. Those are called meibomian glands.
Meibomian glands.
So,
M-E-I-B-O-M-I-A-N, whatever
yes.
that is. Okay,
yes.
So they're right under there, and they've got the oil.
Yes, and then the mucus are very small cells that are actually inside the conjunctiva. So, but all those things.
So where is the conjunctiva?
The conjunctiva is like the skin surface of the eye that's very clear. So you might have heard the term conjunctivitis. Oh. That's where people get infection of the conjunctiva.
Okay, or irritation or redness of
yes.
the eyes there. Okay, so 3 things. Tear gland, the water, meibomian glands, oil, and then the regular mucus.
Yes.
So now, tell me where problems go wrong. Why do people get dry eye syndrome?
So the number of reasons for dryness is extremely large. The most common thing is simply age. So as we age, one of the more common things is we just get dried out. And so that's common in both men and women. Actually, women a little bit more common, and then has some hormonal issues.
So what are the symptoms then if they've got dry eyes, and women or men or older people?
Yes.
Because I've had dry eye syndrome, and I actually went to see you, and you straightened that out. So tell me what happens.
So the symptoms of dryness a lot of people will think, well, they don't feel dry, so they don't think that they have dry eyes. Well, symptoms can be dry feeling, of course.
So you
it
blink.
can be scratchy. It can be a lot of blinking. It could be burning. It could be tearing. One of the more common things is people can get profuse teary eyes, and it's due to dryness. And
I
can
would
explain
never
that.
think I had dry eye syndrome if I was getting tears. Why does that happen?
So remember I mentioned the 3 different components.
Yes.
Okay, so if those components aren't working together, for example, let's say there's a bad oil layer, and so because of the oil not being there correctly, there's more evaporation, and so the eyes get dried out because of evaporation. So what happens, the body says, oh my gosh, my eyes are dry, I need more tears, so the only thing it can do is make more liquid. And so the liquid will kick in from that lacrimal gland. The problem is, there's a lot of liquid, but that liquid doesn't do a good job of lubricating without the other components being there.
So is the meibomian glands, the ones that have the oil, is that one of the big things that goes bad as we get older and we get dry eye syndrome?
Yes, it's very, very, very common. There's another associated condition called blepharitis, which is it's an inflammation of the eyelids, and that really most of the time starts in the meibomian glands.
So the blepharitis, is that like dandruff of the eyelids?
It is dandruff, and there's those little oil glands can get clogged up, and they can cause inflammations. That sometimes people wind up with getting like little styes, little red bump on the eyelids. That usually those things go away on their own, but all that can be part of making the eyes dry. So
what do we do if somebody has the dry eyes? Do we just put in eye drops?
I'd say for most of the time, that's fine. If you were to go into the drugstore, you will see a huge aisle of nothing but drops for dry eyes. It's an extremely common thing. So there's a lot of different products and brands out there. I don't have a strong feeling necessarily what is best. Sometimes it's just trial and error. Some I think do work better than others, but for the most part, it's a trial and error. And for mild signs or symptoms of dryness, an occasional teardrop over the counter is absolutely fine.
So what happens if you're using them all the time? You have to use them 4 or 5 times a day. Because the more I look for it, the more people say, oh, I've got dry eyes, I have to put in eye drops all the time. Where can that be a danger to the person?
So the eye is sometimes associated or susceptible to the actual preservative in the teardrops. So if someone needs to be using drops 4 or 5 times a day, there's a couple things I would say. Number one, that person needs to be using preservative-free teardrops that come in little tiny vials as opposed to a bottle. And really, if you're needing drops that much, you need to go see an eye doctor.
So when you go see an eye doctor, can you tell what's going on with the meibomian glands? Can you tell what's going on with the eyelids? Can you tell what's going on in the tear gland?
Yes, sir, just by looking. I mean, it's not hard. Any ophthalmologist can just look at your eyes, and they can see all those things. You can't really see the lacrimal gland very well, but you can certainly get an idea if it's functioning well or not.
Can you look at the tears in somebody's eyes and say, that looks good, or that looks oily, or that looks watery?
Sometimes, yes.
Okay, so then what do you do? If somebody doesn't go see the eye doctor, what are some of the harms if you've got dry eyes and you don't take care of them?
So severe dry eye can actually cause some scarring on the cornea. So the cornea is the clear dome of the eye that light kind of goes through. We don't see that a whole lot for just regular dryness, but it can certainly happen.
So if you've got dry eyes and you're blinking a lot and they feel gritty and you rub them, you could scratch your own eye and maybe hurt the cornea?
Certainly people end up scratching their own eyes sometimes. And sometimes just from the chronic dryness on the cornea, it can cause some irritation, and not just irritation, but one thing I don't think I mentioned, a very common symptom of dryness is actually blurry vision.
Blurred vision with
So
that.
blurry vision, and the reason for that, if you think about it, when light enters our eye, the first thing it hits is not our eyeball, it's our tear film. And so if we don't have a good tear film on the cornea, that can cause blurry vision and vision that fluctuates.
Is that why you blink a lot sometimes to try and clear your vision?
Yes, sir.
Maybe to do better like that? Are there ways that we can prevent dry eyes from drying over? There are things that we can do.
So sure. So
And that's what we're going to be talking about when we come back. How can we prevent dry eye syndrome? Do you have dry eyes? Do you blink a lot? Are you going to the drugstore and occasionally using drops to lubricate your eyes? Do you know that if you're doing that frequently and you don't see the eye doctor, that there can be some things going wrong, including scarring of your eyes or even autoimmune problems as far as the meibomian glands? Boy, is there a lot going on with the eye just to keep our eyes lubricated. We're going to come back talking about preventing dry eye syndrome. We're talking with Dr. Darin Smith, and we're talking about dry eye syndrome. And there are tears from the lacrimal gland. The meibomian gland have oily secretion for the tears. So you got to have the proper amount of different things in your tears to make the eyes where it's lubricated. And if they're not working, you get dry eyes and you blink and they sting and they get irritated. And sometimes you even get blurred vision because the concentration of the oil in the eyes is different than it should be. So huge amount. I had no idea that all of these things. So can we prevent dry eye syndrome, and how do we prevent it from occurring?
So, like we started out, there's a lot of different reasons that people get dryness in their eyes. So certainly there are things that we can do to combat that. So one common thing would be, for example, smokers. So our environment can cause things to get dried out. And
pollution?
So pollution.
Dry weather?
Smoking. So dry weather. So we see a lot of different things in winter months when people are running their heaters and the humidity in the house is lower. Sometimes that will cause more dry eyes.
Oh, wow.
Sometimes in the summer, likewise, even though it's more humid, which is you would think would be a good thing, people are blasting themselves with air conditioners in their car, or likewise heat in the winter, and that can dry things out. So any kind of air blowing on your eye situation.
Can you wear glasses? Will that prevent the some kind of shades? Does that prevent the air from getting, or does that make things worse?
I don't know if it would make anything worse. It might help a little, but those are certainly things that we see that do impact. Medications. There's a lot of medications that can cause dryness. A lot of those are cold medicines. So things for sinuses, things for colds, just over-the-counter stuff, or even prescriptions.
Oh, wow.
A lot of medications for depression and anxiety.
So those can cause dry eyes too.
Oh yes, very common side effects. And so some of those things you can't avoid. So sometimes you just have to deal with
But you have to recognize,
Yes.
you have to think about your medications, and if you've got dry eyes and you're using the lubrication eye drops, you need to see your eye doctor, and you can tell right away what the tears are like.
Yes.
And you take a history on if they're taking medications that can cause that, or what their environment like, or what pollution, or how you are in dry day. It's really more exciting than I might have normally thought.
Well, for example, two other examples. You mentioned autoimmune disease.
Yeah.
So anything that a patient can do to get an autoimmune disease under control, for example, rheumatoid arthritis or lupus or something like that people who have those things, they know they have them and they're being treated, by rheumatologists or internal medicine doctors. So anything that can be done to maximize the treatment for autoimmune diseases or thyroid disease. So thyroid disease, we won't have to get into all that, but thyroid disease can cause all kinds of eye problems. Dryness being probably the most common.
So what kind of thyroid disease causes most common dry eyes?
Most of the time, that would be the low thyroid.
The low thyroid. So
but it can be anything.
Okay. So you got to think of thyroid. You got to think of autoimmune illnesses, especially a part of rheumatoid arthritis is people that have keratoconjunctivitis sicca. Those are big, long words. What does that mean?
Basically, that just means really bad dry eyes.
Okay.
That's actually so bad, it is actually really causing some problems with the cornea That's where you get the keratosis part of that, that big long word just means cornea. So it's dryness that's so bad that's starting to affect the cornea some.
Does that really drive people crazy, their dry eyes?
Yes. So if you think about it, humans can endure a lot of things. But when something just keeps going on and on and on, it can wear on you. It can wear on you physically and emotionally, and it can cause people to get down and depressed, and almost like you want to give up. And so severe dry eyes can actually do that. I've seen plenty of patients whose dryness is so bad it keeps them in the house, keeps them from functioning in life. So bad dry eyes can really be debilitating.
So when they wake up in the morning, they got dry eyes, do the eyes sort of stick together, and you got to move them and wiggle them and reach for the eye drops and do that?
Oh, that's the first thing some people do. And you mentioned the light sensitivity. Yeah. Sometimes that can be very difficult for people, just because no matter what they do, they have to kind of squint or hide their eyes from any kind of light.
So what I'm hearing is, if somebody is having to extensively use eye drops, they need to be careful that not all of these other things are going on, and probably a professional eye doctor would be the one. There's no question about that. And I was saying probably sort of facetiously, sort of like joking, because you're used to these things. You see them all the time, and you can pick out what the problem is and straighten people out. So we can prevent if we get some of these things under control, like a fan blowing and that. So if it's autoimmune, how do you treat that?
So most of the autoimmune treatments, how can I say this? So first off, internal medicine doctors or rheumatologists need to get that, whatever that disease is, well controlled as best they can. And a lot of the different treatments for dry eyes, so there's other treatments besides just artificial teardrops, okay? So there are actually prescription medications that can be used that actually decrease some of the inflammation.
Restasis?
Restasis is probably the most common.
So how does Restasis help autoimmune eye problems?
It actually works as an anti-inflammatory.
Yeah.
So autoimmune disease is inflammatory in nature. And so the Restasis and its competitor, which is called Xiidra, work in an anti-inflammatory.
Xiidra.
Yes.
Is it better? Are they both the same, or individualized with patients?
I think it's individualized. To me, I think they're similar enough. I don't think it really matters.
So they calm down the inflammation that is part of an autoimmune illness.
Yes.
That's getting more and more sophisticated, we're looking at. So you've got to get the arthritis under control, and you've got to get the eyes under control, and there are all types of medicines. So what is it like for an eye doctor to find somebody who's got just terrible dry eyes, and all of a sudden they say, thank you for fixing it was a simple medication, or it was getting my autoimmune, or it was using the eye drops or a certain way, or talk about this. What's it like to the eye doctor?
Oh, it's fantastic. One of the other treatments that we didn't mention, they're little tiny plugs. So lacrimal glands out here, on the inside corner there's a little hole called a punctum, and what that punctum does is it drains tears away from the eye. So one treatment is to put a little plastic plug in there, right in the office. Takes just a minute, doesn't hurt, easy.
So you put a plug right in here, and that keeps the tears in the eye.
Yes.
Instead of washing them out.
And so you can do something as simple as that and really change someone's, maybe not change their entire life, but certainly make their life more tolerable.
I think it would change their life.
Yeah, I think it probably does.
Dry, sticky eyes and stinky eyes, and they drive you crazy. And if you can fix that, you're in such good shape. Darin Smith, you're a great teacher.
Thank you.
I think what I come away from this is, if you've got dry eyes, know that there's a cure, that you can prevent them, that you can treat them. There's something you can do for that. All you got to do is see the eye doctor.
You don't have to live like that.
Yeah. Thanks for coming to the Dr. Bob Show.
Thank you
You're
for
a
having
great teacher.
me.
Isn't that fantastic? If you've got dry eyes and you're overusing eye drops and you haven't seen an eye doctor, be sure and do that. As a matter of fact, we need to see an eye doctor once a year anyway. And we'll be doing another show about routine eye exams and what the eye doctor can do. But remember, dry eyes can interfere with your life. I want to thank Dr. Darin Smith for that wonderful job. Now, you're going to want to stay tuned. We're going to be talking about sinus disease and chronic cough. Why does having a sinus infection cause cough? It's not just clearing up mucus. It could be a reaction associated with asthma. How can sinus and asthma be the same thing? A lot of information. We'll talk about that and we'll learn about that. You'll want to stay tuned. I want to thank Dr. Darin Smith. Wonderful discussion on dry eyes. I had no idea of how complicated that can be. Now, questions from you, the viewer, that I think will be interesting to your health. Dr. Bob, I've got a sinus infection and my face hurts, but more than that, I've got a cough and it won't stop and my doctors can't stop my cough. What seems to be the problem? Well, there are several possibilities. First of all, let's talk about your sinuses. The sinuses are holes in the head. They drain into the nose. Anything that swells the nose can block the sinus and we get infection. Actually, inside the sinuses, there are little hair-like follicles. We call them cilia, and they milk the mucus out of the sinuses. So if we've got something that doesn't let those cilia work, sometimes that's genetic, sometimes it's blocked, there's no air, there's no communication with the outside. Cilia don't work and we get mucus that accumulates, and when that happens and they fill up, we get pain and we get discomfort. On the inside of the sinus, we can also get inflammation there with the infection. And if we electrically stimulate the sinus, bzzz, then the lungs, through a reflex, the sphenopalatine ganglion, will tell the lungs to cough and secrete mucus. Now, there's also a connection with people that have asthma. Asthma, 15 to 25% of people with asthma, their asthma is driven by underlying allergy that blocks the nose, that takes away the ciliary action, that gives us a sinus infection and sends a message to start coughing and wheezing. So you got to find out if there's allergy, you got to find out if there's a crooked nose, you got to find out why the nose is blocked. Now with asthma, in the airway, there are two things that are going on. Number one, the airway is going to spasm and they clamp down and we wheeze when they clamp down. And you get high-pitched whistles as you breathe out. But there's also inflammation of the lining of that tube of the airway. And the inflammation also causes relative narrowing. So there's two things that we got to work for in the narrowing: a bronchodilator and also anti-inflammation. So most asthma medicines now have anti-inflammation properties in them. Inhaled steroids. Aren't steroids dangerous? Well, they're much less dangerous if you inhale them than if you take them by mouth. So that's a real blessing to be able to have inhaled steroids and also inhaled bronchodilators. So there are medicines that open the lungs and heal the lungs, like Brio, like Advair, like Dulera, like Symbicort. All of those are excellent because they open and they heal the lungs. And so they're doing the things that we want for asthma. So know that if you've got a sinus infection and a dry cough, that it may be due to the sphenopalatine ganglia, or it may be that there's an association with the nose and the lungs. We call it a common airway. When we breathe, it goes through the nose and goes down into the lungs. So we can have both of these things going on. So know that they both have to be treated and treated effectively. So the only way you can diagnose asthma is with spirometry. That's with breathing studies. We call them pulmonary function studies, where when you blow and blow and blow into a machine, the computer will be able to tell you how the air is coming out and if there is obstruction there. If you've got trouble here in the lungs, think here of the sinuses, take care of both. Well, that's all the time that we have for this show. Remember the four things that we talk about all the time. Number one is exercise. Most important thing you can do. Cuts down on stress, helps us lose weight, makes us feel better. You get a runner's high, you feel good with exercise. Most important thing you can do. However, just as important is 7.5 hours of sleep. If you sleep 7.5 hours, you'll feel better the next day. People around you will feel better. You'll perform better. You won't get into as many accidents. You won't fall asleep when you shouldn't. And eat properly. Remember, more fruit, more fiber. We are what we eat. So eat properly. We all know what to eat. And so eat less and exercise more. And most of all, what is it we like? Is that laughter in your life. Remember, find somebody that you love and laugh with them and giggle with them and laugh more and more and more. And remember, the more you laugh, the healthier you're going to be, and the healthier people around you are going to be.